Now, one might be wondering, what are those things that put me at a risk of getting high blood pressure? This can be divided into two. There are those which we call modifiable risks, and then the non-modifiable risks. The modifiable risks mean there is something you can do about them, and if you succeed, you will not get high blood pressure, or your chances of getting high blood pressure will be very low. Then the non-modifiable risks, there is not much that you can do about them. I think I'll start with modifiable ones. Diet, the things we eat. If you're not eating right, you will be at a risk of getting high blood pressure. What is not eating right in this case? One, eating a lot of salt, putting a lot of salt in your sauce, in your food, eating a lot of salty things, that increases your chance of getting hypertension. Eating foods that don't have a lot of vegetables, no fruits, then eating foods that are very rich in saturated fats, and they are what we call trans fats. Those kind of fats which are usually solid at room temperature. The butter, the ghee, and all those things. For as long as when you put these fats to settle somewhere, not on fire, not in the fridge, they will be solids, and maybe when now you put them on fire, they become a liquid again. Those kind of fats are not good because they predispose you to getting high blood pressure. That is diet. Then for people who smoke tobacco and drink alcohol, the risk of getting hypertension is also high. Then for the people that don't engage in physical activities, they don't exercise, they live a sedentary lifestyle, that predisposes them to getting high blood pressure. The people who are overweight and obese, there are parameters if you come to hospital that we shall consider and tell you if you are overweight, obese, underweight, or if you have a normal weight. But being overweight and obese predisposes you to getting high blood pressure. And those are modifiable. There is something really that you can do about them. The non-modifiable one, family history. There are people in their families, it's easy for them to get high blood pressure. They have a predisposition in their family that for them, their risk of getting high blood pressure is high. Now, you cannot modify that. No one has control over the family from which they are born. You just find yourself there. For the people that have other illnesses, like illnesses of the kidneys, illnesses of the glands that produce certain hormones, those illnesses can also predispose you to getting high blood pressure. We have age. The older you grow, the higher the risk of getting high blood pressure, and no one controls that. Currently, we have no medicine, we have no solution for stopping ourselves from aging. Of course, there is a lot of research that is underway, but we have not yet come up with substantial solution to our aging. So as you keep growing, especially beyond the age of 65, your risk of developing high blood pressure also keeps increasing. Now, if you have these other risks, the non-modifiable ones, you come from a family where people have a tendency of getting high blood pressure, you are even supposed to be extra careful when it comes to the other non-modifiable risk factors, because if you have this and you add on the others, your risk will be very high
and chances are high that you will also end up getting high blood pressure. So those are the things which usually predispose people to getting high blood pressure.